people sometimes hang on to what you're saying. And some people look up to you and may say, hey, you know what, I can't believe they said that about somebody. And it makes a real issue. And what's alarming to me, you know, having a population, and I always say this with the military, over 330 million Americans, having 43 million Americans suffering with a mental illness. That's a lot. It's a lot. And only 44% of those Americans receive treatment. Even through the Americans now have more access to services than ever before. And yet, they don't utilize it because you shouldn't be ashamed. Not everyone's perfect. You know, everyone has their faults. Everyone has their problems. Everyone has their days where you wake up and you don't feel like going forward, or just life's bogging you down. You can't be ashamed because there's nothing wrong to say, hey, I'm a little bit different than you. And that's okay. Because that's what makes you unique. That's what makes you who you are, by saying that you are different. Because if we were all the same, this world would be pretty boring, I would say.
Albany County has long been a supporter of issues around mental health. And we're here this morning because of the commitment that the county has shown. And I wanted to thank the county executive for giving us this opportunity. So, thank you, boss. So mental health, May is Mental Health Awareness Month, and what we have tried to do over the years is to recognize the strides that people living with mental health challenges have made. And this year we are also recognizing the challenges that people with mental health face, the challenges that are faced by people who have mental health challenges. Stigma is one of them. The title of today's panel discussion is Stigma, Bigotry, and Discrimination, and I think that was intentional because these are related. For the sake of our discussion this morning, discrimination is referring to the behavior or the action that separates groups of people. Bigotry is the attitude that underlies that. And stigma is the strange third component. It's got many definitions in medicine and botany, but in this context, it talks about an unseen mark or stain that is used to characterize a group of people, in this case folks in the mental health world. And it is also a unseen mark or stain that people use often to characterize themselves. The problem, of course, is that discrimination, bigotry, and stigma get in the way of people being all they can be. So we have put together an esteemed group of people that I can call colleagues, coworkers, and friends to talk about this, and hopefully the goal is to work towards overcoming stigma, bigotry, and discrimination. Each of you in your own respective domains of life and work fight against stigma and its negative effects on a daily basis. I wonder if you tell us why it's important to address stigma from your perspective, and what, in your view, is the biggest challenge we face with regard to stigma.
County Executive McCoy, in his introduction, made a couple interesting stats that only 44% of the people who have a mental health condition will seek treatment. An even scarier stat in my mind is that it takes people on average 10 years from the first symptoms presenting themselves to begin treatment, and that's way too long. Obviously, we know the earlier that we can address these issues, the better the outcomes will be. And certainly, stigma is a big part, a big barrier keeping people from these treatments. It's not the only one, but it's certainly one that I think in some ways we've made the most advances in overcoming. We still have a long way, but I think people still have that feeling of shame of having a mental illness and that stigma, and I think society still has those kind of old beliefs that are starting to change as we're seeing more people talk about, which is really exciting. I think in the 10 years I've been with NAMI, this week marks my 10 year, I think we've come light years from where we were a decade ago, and that's exciting. But we're also more concerned about, discrimination policies, the difficulties people are having finding services that take their insurance. I mean, that's discrimination, and that's, in some ways, I think, a bigger problem than the stigma. It was interesting that during the budget testimony and a couple weeks ago before the Senate Mental Health Committee, OMH Commissioner Ann Sullivan has said that you're going to get better mental health coverage under Medicaid than you are through insurance. So I think, those problems show just how deep the stigma is on all levels and that discrimination. And I think, we really have to focus on eliminating all the barriers keeping people from treatment.
So when you are talking about things like, housing, things like employment, beyond the realm, socialization, social isolation, things like that, there's so much stigma that's impactful in that. And I know from, the work I've done over the years around public policy is that it is incredible that there's still the stigma that exists. I mean, you don't want to personalize it, but I've seen it at the personal level as well, about the stigma related to family. When you're a family member, the things you face in terms of the stigma of the illness that, like, wow, this is unbelievable. And it's shocking in this day and age that people are still feeling this way. So, I really, encourage forums like this, because I think it's incredibly important to have these kinds of conversations, because otherwise people are still, in many ways, in the dark ages. We have come along, and I'm going to talk about this as well, and as Matthew said, in his 10 years, we have come a long way, and we have, over the years, really, and I think when I started years ago, we have come so far, but yet in many ways we still have so far to go. And I think that's the frustration that a lot of us feel. But again, stigma does override so many things and is very frustrating, as Matthew talked about with mental health parity, how we had a parity law that was signed into law, virtually almost a decade ago at this point.
As you can imagine, when I was hired, I'm a biracial woman with a disability. So already I walked in the room with trouble. It's been many years that I've been there, as they've said, 18 years, and still to this day, I still feel from certain people that I am just a person with a mental illness and that I don't really have that much to bring to the table. I hope over the years that I have shown people, a different side of me. Now, yes, I'll have to say there have been times at the job where I've had issues, where I've needed support, and I'll have to say on the other side, if I hadn't worked in the mental health clinic, then I probably wouldn't be as far as I am today. So in the beginning, it was rough, and it was less rough, and became less rough. And now today, who would have ever thought that me, 18 years ago, who came to this job really not knowing much about what it entailed, would be where I am today. So I have to thank the people that have taught me, the people that have supported me, and the people that have guided me along the way to help me to get where I am.
How does stigma affect age, gender, and race differentially?
Obviously different cultures look at mental health and psychiatric issues differently. I think, we still have a lot of challenges in the African American community and the Hispanic community and the Caribbean culture. We're making inroads, but there still is that lack of understanding. I think there's still a view of it being a sign of weakness. It's something that, the New York City First Lady Shirley McRae talks about a lot, that when her parents were suffering from mental illness, it was looked at as a sign of weakness, that they weren't strong enough to overcome it, or they should pray their mental illness away. And we know that, you would never say that to, well, maybe some people would say that to someone with cancer, that you can pray it away. There are those religions. But, I think there still is a lack of understanding there. But we are seeing improvements. In New York, there are African-American churches now that have mental health clinics in there. and we are making advances, so that's really exciting. As far as age, in some ways, I think that's where we've made our biggest advancements. The most inspiring thing to me at NAMI has been when you go to schools or when I talk to members of our young adult network who are really speaking up about this. I say this all the time, that I really think this generation, the ones that are in high school and college now, are the ones that are going to bring an end to the stigma of mental illness. The work that they're doing is just incredible.
Yesterday, prime example, we were watching our friend's daughter, who's 13, and we're just having conversation and talking about mental health, and she suffers from anxiety, and she's talking about the anxiety, and she said, so many of our friends, we have these conversations all the time. I mean, we can get into a whole discussion about social media. The good part about things like social media is that there are these networks have been developed. There are a lot of issues with social media and mental health related, but that's one of the good things about social media, is that there is more of a fraternity among young people to talk about this more openly, which is great. That's great. I think one of the issues that we're still seeing in terms of the stigma and the system of care is two. First of all, I would say transitional age youth, those youth between the age of 16 to 24, we see sometimes that there isn't that cross collaboration that we'd always like to see happen. So, you're going from the kids services into the adult services, and sometimes, and again, I use the example of my son sometimes, who's 23, when he was, 19, all of a sudden he was, going to adult services with people who were 40, 50 years old. It was not as relevant to him. And I think those kinds of, subtle differences are very important. So we really have to make sure that we are engaging 16 to 24-year-olds at a different level than we're engaging youth, and a different level than we're certainly engaging adults. So that's a population that we have to continue. And, we've been talking about this for many years. And there are collaborations that are going on that are very successful, and that's positive, and that's good. And the whole, children's mental health managed care piece is something that when it gets off the ground, we're very excited about the possibilities around that. The other issue, what we talk about, is ageism. We're talking about people in their mid-60s, et cetera, who we know among populations, that's among the highest percentage of people who complete suicide.
When my grandmother, she was my grandmother, so we would, a daily trip would be down to Poughkeepsie to a hospital to see grandmother. We didn't know what the hospital was. We didn't know what kind of treatment they provided, but it turned out to be a psychiatric center. We had no idea. So we didn't really feel the stigma of grandma being in a psychiatric center. But then, the next generation being my parents, when my father was given Thorazine, we heard the name Thorazine, but we didn't know what it meant, so didn't really cause me to think, like you, that mom was ill, or grandma was ill, or dad was ill. But then, when you get to my generation, when I came back to Albany from downstate, I was in a really different part of my life. I was getting divorced, I had been abused, I just had so much going on that I needed some help. And I'll never forget my mom taking my hand, and we were going to the primary care doctor, is where most people get their first introduction into the mental health system. So after years and years and years, maybe 10 years, like you said, of trying different medications and therapies, I've come to be the person that I am today, which leads to my son, which is a whole other different generation. And growing up, he had his set of issues, and he was diagnosed with learning disabled, ADHD, oppositional defiant, and those are a lot of labels that young children get these days. So then I found myself knowing that I can understand how he feels, because a lot of times when I was growing up, I had the same issues but really didn't know how to express them. So I did the best that I could to educate my son, to let him know that those words are just labels that they put on you, and these are things that we need to do in order to get your life on the right track. So I know you have the means and the ability to be more than successful, so this is what we need to do to get it done.
I just wonder if you have thoughts about If they are us, that means that's us. So why do we have to have these conversations about the fact, and it's great to hear that things are changing and getting better, but why is still, Glenn, you said stigma really is the overarching obstacle and challenge. So what is it about us that doesn't let us see us?
I think it's so ingrained in our society, through the media and familial beliefs and things like that, that it's very difficult to overcome. I think, again, the fact that Vicky kind of mentioned it in a way that once you have a mental illness, it's a lot of work in a way, work to maintain your recovery. It's hard. Like I was talking to my brother who's having some issues, and he's like, I don't know how much therapy is helping me. And I go, well, are you putting in the work there? You're just telling your doctor what you want to hear. It's like, a sports analogy, going into the batter's box and not swinging. You got to do the work to do it. And it's not easy work. It's digging up painful things, troubling things, it's things we don't want to face, especially if, Vicki mentioned, if you have trauma in your past and that's one of your underlying issues, to re-examine that is hard.
And that was really well said, Matthew. I agree with everything you said, and it's sort of like, so we're in the state right now where it's like the duality here, because we have, on one hand, we have acknowledged that things are getting better, with our youth, with young people talking more openly about it. There's much more normalcy in the process. And on the other hand, we still, as Steve, as you pointed out, despite everything, we still have all this continuous stigma that exists, perpetuated a lot of times by the media. It's so true. If even now, even in this day and age, you still see commercials with a crazy person. You'll still see, movies and TV shows all the time where the psycho comes out of the, escapes from the psychiatric ward and goes and kills 12 people. I mean, what kind of world is this? I mean, it's so ridiculous. And unfortunately, that is still a perception of a percentage of people. Again, the younger people completely understand it, but to the mainstream people who are not generally affected in a normalized way about mental health related issues, it doesn't register with them. What registers to them is that, that crazy person's going to go out there and do these wild things. And it's so unfortunate that inherent bias is still there, and we have to continue to fight it. And we are doing a lot of things to fight it. And I think that's really important to acknowledge. There are things out there that are changing, again, not just with the kids, but on the adult world as well.
Over time, people have become a lot more open to discussing it, and I'll have to say, and part of that reason is because I've become a lot more open in discussing it. And people will look at me and they'll say, oh, there's nothing wrong with you, you don't have this, you don't have that. And I'll say, you don't really know what I have, but what I have done is I've worked really hard to take what I have and to make the best of it. Now, being depressed and not getting up and not wanting to go to work, I think that happens to everybody. The sun isn't out, you're like, ugh. Sun's out, you're like, hey, that's a little bit better. I think that's for most people. So I just want to say that the kids these days are a lot more open. And I just want to say about providers and parity also. It is so hard to find a mental health provider these days, it's amazing. As I had said before, my first introduction into mental health was through my primary care physician. They'll give you a little something to take the edge off, but they're not going to really engage because to them, they don't understand it. So then you go to a psychiatrist, and after you can finally get an appointment, and I've had 3 or 4 providers in the last 2 years. My one provider gave me to the other provider because his comment was, well, I've never seen you really bad, so we're going to give you to this one because, they're not going to have to do a whole bunch of work with you. And that's a provider talking. So I'm saying to myself, well, gee, if the provider's talking like this, I wonder what message they get, the person gets from the provider. But I'll have to say that our providers are very caring, they're very sympathetic, They're very supportive, and it's very important that you do get a provider that you are able to really share and connect with, because otherwise it's not doing you any good to go to that provider and seek any help.
A real kind of change in conversation in terms of how we pay our folks. What does that say about society? What does it say about the stigma of mental health issues when people are still struggling to get by, working full-time in the mental health field, and yet still having to work 2 or 3 other jobs? So I think that's incredibly important. Issues have been raised. The administration, the executive budget last year reflected in a raise in salary, which was wonderful, but we can't just give that raise and then walk away from this issue. This is an incredibly important issue.
In 10 years, looking back upon today's system of care, what will we say about what we're doing today as it relates to mental health? Are the ingredients present today for a better system of care in 10 years? Or will we look back and say what we are doing today is primitive?
Hopefully in 10 years, we'll look back and say, man, can you remember a decade ago when we didn't have enough mental health housing, and there were still so many people that were homeless living with a mental illness, and so many people in jails that were living with a mental illness. So we have we're planting really good seeds right now, but if we don't take care of the seeds and fix everything else around it, then those seeds won't be able to grow properly. I think it's a very big machine, and it only takes little cogs of that machine to be dented for the whole thing to go off the rails. So it's kind of a mixed bag. We're seeing very exciting initiatives all across the state, but we still have a lot of things that are presenting barriers. So
I would like to think that in 10 years, being an optimist, that a lot of what Matthew said would come to fruition. I think the biggest issue now that we see is the integration between behavioral health and physical health. And I think that is a huge issue, because what happens there, many of you are probably familiar with DSRIP and Medicaid managed care and all that fun stuff, but the genesis behind this was the idea of the integration. And, you had referenced the whole idea of going to the general practitioner around, mental health needs. And I think, Vicki, you're right. And it's unfortunate that, in some ways continues to exist. Yet it's great. General practitioners should have a greater understanding about behavioral health needs of an individual. So when we're talking about the physical health needs, we have to realize there are so many social determinants around this, and there are so many individualized mental health needs, why somebody is much more likely to have a mental health issue than other people. You have to look at those social determinants, and you have to address the greater population. So hopefully, again, the whole process is to normalize individuals with mental health issues no different than anybody with HIV or diabetes or anything else, that we are hopefully in that framework where we're going to move forward and say, okay, you have a physical health need, you have a mental health need, we should be integrating. We shouldn't be sitting there. You shouldn't, as a side issue, sit there and say, because you are taking mental health medication or because you're not physically active, you are more prone to heart disease, you're more prone to obesity, you're more prone to something else. Well, let's integrate that. Let's not have the physical health people here and the behavioral health people here.
I had been working with somebody with another group, Mental Health Empowerment Project, and we did this training called Peers in the Workplace. And we had, at the end, we had all the, people, filled out a survey of the things that they were talking about, they thought after the training. And I looked at it, and the things that I highlighted are still the same things that we're talking about today. So I said to myself, wow, have we not come any further than we did in 2000 to today? And I've come up with the conclusion that, yes, we have come further, and the reason that we have came further is because this was said behind the scenes in our little peer group, and now it's being said in front of everybody. So that is definitely reducing the stigma there. And this was, I made up these things, and it was like, we're growing, we're going to be a sunflower, and this is when they got their certificate. So to know that you don't have to just keep it in the room, that now it's time to go out and tell the world.
So this piece is called My Secret Cell, and it's for those who are living with mental health concerns, who pretty much, they can't really verbalize it because of the stigma attached. There is a secret in my body and my mind keeps telling on me. Tells me I am disgusting. Tells me not to dream. Tells me I am nothing. Tells me things. Tells me to bury the body of my feelings underneath the psychic screams. I am a war-torn building, a mess of fallen debris. I am missing myself, and I can't tell anybody, because I'm not the good kind of crazy. The kind that's good at parties, quirky, silly, zany. I am not that kind of crazy, but rather the kind of crazy that's an emergency, that bleeds heavy from ripped skin openings, the kind that hears voices in the crevices of my flooring, the kind that keeps answering the phone because no one keeps calling. And I can't tell anybody about these feelings, because I'm not the good kind of crazy. The kind that keeps the laughter funny, charming, cute, adorably something. The kind that doesn't mind being called crazy. I mind being called crazy. I mind being raped by a label that doesn't quite fit me. Yet the only thing compliant is my silence, as I am complicit in my own crying that sometimes wants to yell out of hiding but instead speaks in the dialect of violence. I am not the good kind of crazy. The kind that deems me genius, but rather the kind that makes me see things, makes other people nervous, the kind that makes me worthless as I keep the hurt in. I am the kind of crazy to be suspected. Every action questioned often. I am not to be trusted because my perception is distorted. The image of my condition is dressed in slit wrists and bloody bandages, padded rooms and medication packages. Vicious judgment interwoven in my stitches as the doctors apply their stigmas and call it concern, another prescription. When they don't know, my mother doesn't pick up the phone when I call. And my neighbors don't look at me for too long. And I'm always a worry in someone's buckled brow, always too heavy to carry in a world with broken arms. And so sometimes I feel alone and want to let go, because I care so much about the world and know I'm hard to hold. So when the knife moves slow across my thin bones, the ghosts let go. I don't see them no more. And the heavy don't feel so heavy like it once did before. And the secret that I keep in becomes an open mouth that speaks sure, instead of the teeth that gnash themselves bloody whenever I tell myself out. Most days I become a whisper that speaks my disappearance ever so clearer. I drown deep in the well of my unwell and swallow myself inward. I become everything I refuse to tell, as no one likes to see themselves reflected deep in someone else. So I become the shadow that mirrors what just won't tell. The secret never told, locked in the same prison, just in a different cell.
I wrote the poem. It's called Changes. I shared the poem with my manager at the volunteer office. I'm a volunteer at Albany Medical Center. And her name is Kelly Marone, who she submitted the poem to Ron DeSandro for copyright purposes. I felt the poem was appropriate for then President Barack Obama's platform Change. I would like a minute to read the poem to you. Changes. Changes can hinder some and grow others. Either way, time is needed to reveal what is on the inside. Keeping situations hidden, thinking no one will be hurt. In reality, feeling the pain that many challenges has brought. Honesty to yourself and what you're dealing with makes a big difference. Secondary but necessary is support which is always available to take hold to and receive its benefits. Communicating may not be easy in the beginning. With determination, pure heart, and desires where they should, the desire is to overcome whatever to live. Envision a caterpillar. Think of the transformation in stages. Once the pieces come together, we can appreciate what it becomes and delight in the beauty of the end. Art is a celebration of the mind and body connection. I submit this poem to the White House under the presidency of Barack Obama and was pleased to have received a copy, a response. Thank you for listening to my poem.